Health experts are worried that people are avoiding the emergency room because they're worried about being exposed to COVID-19. Kelly Chapman talks with an ER doctor from Intermountain Healthcare about that.
We all know times are very different right now, but life goes on. So what happens if your family has an emergency that is not coronavirus related? What do you do? Where do you go? Dr. Adam Balls is here today. He is the chair of emergency department medicine at Intermountain Medical Center. Dr. Balls, thanks for taking the time to be with us. It's a big question many families may have. What do they do and where do they go if they need help?
Yeah, we would like people to continue to seek care the same way they did prior to our preparations for COVID-19. What we have seen is that some patients are afraid to come to the hospital or the emergency department out of the fear that they may contract COVID-19 in the hospital. We want to relay the message that the emergency department has taken necessary precautions to make you safe as you seek emergency care. We do not want you to delay seeking treatment, as delay may have adverse effects on treatment of stroke, heart attack, traumatic injuries, and other type of infections.
You are still there for the community. Dr. Balls, talk about internally what you've done at the hospital to make sure people are safeguarded, those that possibly could have the virus and those that don't. Do you have two different staffs working in the emergency room?
We have separate areas that we have created because of COVID-19. Each of our hospitals across the Intermountain system and within our emergency departments have created a separate cohorting process where we separate patients that may have infectious respiratory COVID-19 type symptoms from the rest of the emergency department patients that are seeking care. So you're triaged by a nurse. You're asked, do you have cough, fever, shortness of breath type symptoms? If the answer is yes to any of those questions, a mask is placed upon you. You're directed to a different area in the hospital where a special staff in the right personal protective equipment can care for you. If you don't ask a yes to any of those questions, you still have a mask put on you as a precautionary measure. The staff in the rest of the emergency department are also wearing the proper personal protective equipment in those lower risk situations. So we do have separate and distinct processes for COVID-19 patients and then for the rest of the patients that we're treating in our EDs.
It sounds like the system you have has been perfected. You mentioned a couple of the emergencies in which people should go to the emergency department, that being heart attack and stroke. What other things may people experience that they should still go into the hospital?
I'd like people to think the same way they did about 6 to 8 weeks ago. If you felt that your condition or how you were feeling required you to either call 911 and have the paramedics come to your house or come to the emergency department and have a family member bring you to the hospital, we want people to think the same way. We don't want people necessarily to think, should I go to the emergency department or the Instacare? Should I wait and call my doctor? If you feel that your symptoms require emergent treatment, that can be severe abdominal pain, shortness of breath, weakness, severe headaches, traumatic injuries. The list is quite wide and extensive. So we want people to know that they can be safe seeking care in our emergency departments and that they should please not delay seeking care. Our staff and our experts in the emergency department are here. We're available and willing to treat you, and we're doing so the same way that we did about 2 months ago.
Dr. Balls, what if somebody has an injury or is sick, but they don't believe it requires emergency room care? Where else would you direct people right now? Are urgent care facilities still available and open?
Yes, the Instacare facilities are still available. They are also taking the appropriate precautions. So that there's telemedicine interfaces that we've set up and expanded because of COVID-19. So if people are in doubt and they don't feel that their condition requires immediate treatment, we would ask them to call Connect Care through the Intermountain system, try to speak to their doctor if it's during business hours. But our Instacares and our emergency departments are operating very the same way that they did and willing to see patients in the same manner that we have over the last few years.
We are lucky and grateful to have such resources like Intermountain Healthcare in our own community. Dr. Adam Balls, thank you so much, and thank you for all your hard work throughout the past couple weeks and weeks to come.
Great, thank you.
Appreciate you.